Boswellia serrata has been traditionally used in folk medicine for centuries to treat various chronic inflammatory diseases. The most well-known practitioners using boswellic acids come from Ayurvedic healers in India. These acids derive from the resin of Boswellia trees known as frankincense. I'm about to show you why this particular substance is such a great anti-inflammatory agent and which Boswellia supplements are the very best out there for your specific needs. So let's get started. The two primary boswellic acids are 11-keto-beta-boswellic acid, or KBA, and 3-acetyl-11-keto-beta-boswellic acid, or AKBA. The other four majors are the alpha-boswellic acid and its isomer beta-boswellic acid, and then the acetylated forms of each of those. So these 6 acids seem to be the main focus in studies for treatments of chronic inflammatory diseases, because boswellic acids are able to inhibit pro-inflammatory enzymes such as 5-lipoxygenase, AKBA showing the most potent effect. AKBA also inhibits prostate tumor growth by suppressing endothelial growth factor receptor 2. These natural compounds can dampen the inflammatory response, but also simultaneously reduce oxidative stress. And boswellic acids significantly inhibit matrix metalloproteinase. These are enzymes that break down cartilage, collagen, and connective tissues. Modern research has confirmed the effectiveness of Boswellia for healthy lung and bronchial function. Studies have shown Boswellia serrata can reduce pain and considerably improve knee joint functions, in some cases providing relief within 7 days. Clinical trials of Boswellia also have shown to improve symptoms in patients with osteoarthritis or rheumatoid arthritis. Its medicinal properties are also widely recognized in some cancerous diseases, wound healing, and for its antimicrobial activity. It also helps with memory, mental focus, and may help relieve anxiety and support healthy mood. Many studies have shown to improve symptoms in patients with ulcerative colitis, inflammatory bowel syndrome, and asthma. And it may also help the cardiovascular system and relieve minor headache pain. That is quite a list of benefits, I would say. Now, there are a lot of Boswellia supplements out on the market today. I'd say it's one of the more confusing supplements to shop for, with all the different standardizations and trademarked formulas you can find. You have just your regular full-spectrum Boswellia resin, various standardized extracts, the Phytosome form, Boswellin, 5-loxin, and a press flex, formerly called Aflapin. There are some other trademark brands as well out there, but these are the Boswellia products you're most likely to see. So I'll quickly break down each one and let you know the pros and cons. The full spectrum Boswellia is going to be the cheapest by far. I mean, we're talking like a couple bucks for a bottle. But it's not anywhere close to having the required potency to make a real difference against well-established chronic diseases in the body. Boswellic acids are also not that bioavailable, so you're not likely to get much out of these products at all. The generic standardized extracts offer more of these amazing acids, but the absorption into the bloodstream will still be a concern. Absorption at the level of the intestinal cell appears to be quite good for boswellic acids, but very poor at the serum level. And bioavailability might suffer even more from the fact that the natural composition of Boswellia's compounds has been altered and out of balance. If you go with these generic products, I'd recommend taking them with meals rich in fats. AKBA absorption can be enhanced with fatty food intake, and liposomes can enhance absorption of all boswellic acids. Which brings us to the Phytosome supplements. Given the poor bioavailability of the boswellic acids, products that have formulated the extract with Phytosome technology will greatly help to optimize absorption. The serum levels and tissue deposition of boswellic acids can be markedly enhanced by a lecithin delivery form or Phytosome. And Phytosome delivery has also shown better results and significantly higher concentrations in brain tissue following oral administration. So if your main goal is to use Boswellia for neurological conditions like Alzheimer's or other various dementias, I'd go with this form. And then finally, we have the brand names. Boswellin flashes the best looking standardization number at 65%, but that's for the total boswellic acids. It actually breaks down to 10% AKBA, 20% other identified acids, 35% organic acids. So don't be fooled by seeing that 65% and thinking it's more potent than the rest. 5-loxane presents 30% AKBA, and a Pressflex gives 20%. But that doesn't quite tell the whole story either. A Pressflex appears to have better overall anti-inflammatory effects, relative to both standard Boswellia Serrata and 5-loxane, due to it having more AKBA reach systemic circulation. A comparative study of 5-loxane against a Pressflex noted that a Pressflex was able to outperform 5-loxane on all measured parameters, while both were significantly better than placebo. And this study was funded by Layla Nutraceuticals, producer of both supplements. So to me it looks like a Pressflex or the Phytosome are the two best options for high quality Boswellia supplements. I'll link both forms that come from reputable companies in the description box if you're interested in trying them out. The dosing guidelines are generally 300 to 500 milligrams 2 to 3 times per day, but this can vary depending on what condition you're taking it for. For example, the Arthritis Foundation recommends 300 to 400 milligrams 3 times per day, but you'd need a much higher dose than this for irritable bowel diseases. So I would definitely search out the recommended dosage for the specific condition that you're looking to use Boswellia for. Boswellia can be a powerful remedy when it is taken correctly and in the most bioavailable forms. It is certainly a safer long-term option than non-steroidal anti-inflammatory drugs like ibuprofen or acetaminophen. Please share this video with people you think can benefit from Boswellia. Click that like button and subscribe if you haven't already. Until next time, stay healthy everyone.